morning I'm joined by Will Flanders, who is from Wisconsin Institute for Law and Liberty. Good morning, Will. How are you?
Good morning. Doing well. Thanks for having me on.
Yeah, absolutely. Well, let's talk about healthcare price transparency. I mean, who wouldn't? I mean, we were talking about this off air, but I said it's just sort of a peculiar situation where nobody really knows how much anything costs, any kind of treatment or whatever it may be, when it comes to a healthcare provider.
Yeah, you're exactly right. You know, the biggest fear a lot of folks have when they have to have a medical procedure isn't necessarily, how long am I going to, what medicines am I going to have to take? Am I going to have to stay overnight in the hospital? But the fear is with that bill that's coming down the line that you really have no idea of how to estimate in many cases. And there was a new bill that was announced yesterday by Senator Felskowski and some other folks that looks to address this by creating price transparency in the state of Wisconsin. We were happy to be a part of that rollout, and we think this is good legislation to help move the ball forward so folks can figure out finally what they're paying for their medical expenses.
Well, I know there have been conversations in the past, too, about allowing people to shop across state lines for their health care providers. And, I mean, I don't know how well that has gone. Obviously, we are all familiar with the fun of Obamacare, but I'm curious to know about whether or not you feel as if this is actually going to get somewhere. I mean, we're actually going to make some headway, and that this particular bill that Senator Felskowski is supporting will it have bipartisan support, and will Governor Evers sign it into law?
So I think there's a chance. I think this is an issue that really crosses partisan lines. If you look at polling, it's a 90-10 issue, right? It's one of those rare issues where you can get folks from both sides of the political spectrum to say this makes sense. It's common sense, right? That when I go to the gas station, I know what I'm going to pay. When I go to the grocery store, I can see the price of milk, which has obviously been going up disturbingly lately. But everywhere else you go, you can see the price that you're going to pay, and you know where that is before you go out the door. It's common sense that the same thing should exist in our healthcare industry. So we think there's a good shot. There are, those that would say this is sort of an onerous thing to put on to the businesses themselves, and we recognize that can be a challenge. But the healthcare cost explosion is a huge problem for folks across the income spectrum, across demographic lines, and it's going to take the industry working together. To the industries, both the healthcare side and the insurer side, to eventually solve this problem.
Well, and I think a big part of it is the health insurance companies, and I think it's almost as if they get in the way of the relationship between the patient and the physician, and I think that's been a part of the problem for so many years, and I guess I think that this problem has been kicked down the road for years and years. I'm thrilled that Republicans at least are taking the lead on this, and I hope it moves forward. I mean, I guess you say that you think that there's a chance of that, so that's good news.
Yeah, absolutely. I think that the challenge here, long term, is that we haven't really had a free market in healthcare in the United States, at least since the 1970s. And with things like Obamacare, it's only even gotten worse. So there's really blood on a lot of different hands here, but I think the government obviously plays a huge role that we shouldn't ignore. But again, it's going to take sort of removing those barriers and government, insurers, hospitals all working together to achieve this goal, because it's very critical that we make some changes in this regard.
Well, then my fear always when government is involved in anything is that if they try to take control, because obviously we know that a certain side of the aisle would like for taxpayers to cover the expense of health care for all, and obviously that's not something that I support. That's obviously not something perhaps that you support either. But how do we ensure, no pun intended, that government doesn't get in the way of the positive that can come from this price transparency?
Yeah, so we think this is really a move in the opposite direction. I think what we know from market theory, you look at the work of people like Milton Friedman, right, famous libertarian conservative economists. We know that in order for the free market to function, people have to know what they're going to pay for their goods and services. That's a key part of a functional marketplace. And We think before we go down the road of socialized medicine, we at least ought to try the free market first. It really hasn't, as I said, existed because of government intervention in more than 50 years at this point. So I think we'd argue this is a move away from government intervention. The only caveat being, we're sort of requiring that some of that information be put out publicly that companies may see as a bit of a burden. But in the long run, this is a move towards the marketplace and away from sort of a system that's completely under the thumb of the state and federal government.
Well, and I think, too, the healthcare model is changing. I know there are a lot of, inspired, I think, in great part, due to the shamdemic, as I like to say. There are a lot of independent physicians and health practitioners that have decided to separate from the big healthcare organizations and really even separate from the health insurance companies and are providing services and to their patients, and they are already implementing this price transparency, whether it's a service by service basis or if it's actually a monthly sum that they pay for having the practitioners for having the access to the practitioner.
Yeah, absolutely. If you want to see what the system could look like, there's the well-known, national talk radio folks have talked about the Oklahoma Surgery Center quite a bit. You can go on their website and see the out-the-door price for a large number of different procedures. The goal with this legislation would be to create a out-the-door price for about 300 common procedures that folks have. But you're right, the changes in the industry play a huge role in this, particularly when folks have healthcare plans with large deductibles. It's no longer just your copay that you're paying when you go to the doctor's office in many cases. Many folks around the state and the country are on these high deductible plans. In those cases, the price out the door matters even more because it's literal out-of-pocket costs for the consumer. That's maybe a negative change in some ways, but on the other end of the spectrum, you have doctors opening their own practices. One of the folks that spoke at a press conference announcing this yesterday said he went from a herniated disc procedure that was going to be over $3,000 at the existing hospital, but he found a sort of private independent doctor, and the price went down to $1,200. So having that information is a big savings to consumers, particularly in this environment where folks have really high deductible plans where they're going to be paying a lot of that cost themselves.
I guess it drives competition within the market. So how do you perceive the healthcare systems and the health insurance companies are going to react to this?
Yeah, so we'd like to think that, across the board, folks would see this as a problem and sort of move in the direction of transparency. I think obviously from entrenched interests, there can be a reticence to make changes, even if those changes are needed. So there's likely to be some opposition from some of those groups that you mentioned. But we hope in the long run we can all come together and create a system that functions much more effectively for the consumer. And in the long run, I think it's beneficial to the industries as well, because if you look at public perception of hospitals, if you look at public perception of insurers, those are some of the lowest rated professions or lowest rated fields in the country, because folks inevitably deal with a lot of issues when they have to have a medical procedure. So we think in the long run it'll benefit the industry, improve perceptions, but obviously there can be some hiccups in getting to that stage.
Well, speaking of consumers, what can our listeners do to ensure, again, no pun intended, that this bill moves forward and that we can see some of these positive changes to healthcare price transparency?
Yeah, so I think the old mantra of contact your legislators. The bill has a title of the Know Your Healthcare Costs Act, and folks they think this is a good idea and they'd like to see this move forward. Nothing helps more than some public pressure. So I think that'd be the number one way that folks could contribute.
Well, and I see that in addition to Senator Mary Felskowski, Senator Julian Bradley is part of this initiative, Representative Rob Brooks and Representative Donna Rosar, who is representing some of our listening area. So I think that's a great start. I think I presume, and actually Senator Mary Felskowski is going to be joining me on the program tomorrow. So I will probably we will have this conversation too and find out how we can help move this forward. But I'm so glad that Wisconsin Institute for Law and Liberty is involved in this, because I think with your backing, I think that this can become reality, and I'm hopeful that it will receive bipartisan support, and we'll see some taxpayers as well as citizens throughout the state of Wisconsin will see some relief.
Yeah, thank you. Absolutely. Senator Bradley mentioned yesterday the fact that you see the coalition of folks supporting this bill. We have Senator Bradley from the Metro Milwaukee area all the way to the northern part of the state with some of the other folks on the bill. It just highlights this as an across-the-board problem. And, we're very hopeful that we can make some serious changes this year that'll really be meaningful to Wisconsinites' pocketbooks.
Well, Wisconsin Institute for Law and Liberty Research Director Will Flanders, thank you so much for joining me this morning. I appreciate your efforts and look forward to our next chat.